My name is Emma Paulino. I am president of the National Pharmacy Association in Portugal. Pharmacy-based vaccination in Portugal has been regulated since 2007, when we had a new decree law that allowed community pharmacies to provide a range of new pharmaceutical services. Since then, pharmacy-based vaccination has evolved, but we have several necessary requirements, so we are regulated in terms of infrastructures, the type of equipments that we must have in community pharmacies, the premises and how we organize those premises, and also in terms of the materials that we have to have in community pharmacy, both to administer vaccines and also to cope with any adverse reactions that we have within the pharmacy. Healthcare professionals are also regulated, so in Portugal we can have either nurses that are hired by community pharmacies to provide the service, or community pharmacists who have to be authorized to administer vaccines and other injectable drugs in community pharmacies, and this competence has to be approved by the Pharmaceutical Society in Portugal. The training for community pharmacists in Portugal comprises training on the administration of vaccines and also basic life support training that we have to renew every 5 years. In Portugal, we are allowed to administer every vaccine that we are able to dispense in community pharmacies. So this means that we have around 20 vaccines that we can administer in pharmacies, but these have to be administered by having a prescription by a physician to be able to dispense and administer the vaccine. There is an exception for flu vaccines and for COVID vaccines. Since 2019, we are able to dispense and administer flu vaccinations in community pharmacies without prescription, and also since last year's campaign in 2023, we are also able to dispense and administer COVID-19 vaccines without a prescription in community pharmacies. In Portugal, we are allowed to administer vaccines in community pharmacies since 2007, where we had a change in legislation that allowed community pharmacies to provide a range of new pharmaceutical care services. Since then, we have been able to administer more than 20 vaccines directly in community pharmacies, and we have contributed to increasing the coverage of vaccines in Portugal. We are able to administer flu vaccines since 2008. And throughout the years we have increased the number of people that we vaccinate in community pharmacies. In 2023-2024 campaign, we were also able to dispense and administer COVID-19 vaccines, and that allowed the country to expand its vaccination centers by almost 400%. We went from 1,500 vaccination centers that were based on the national healthcare system's infrastructures to more than 3,500 vaccination points, because we also added more than 2,500 pharmacies to the service. Community pharmacies in 2023 in Portugal administered around 70% of all flu and COVID-19 vaccines in Portugal, and this allowed us to either maintain or exceed the vaccination coverage for flu that we had from previous years, and for COVID-19 in 2023-2024 we even had 5 times the average COVID-19 vaccination coverage in Portugal as compared to the European Union. So it was a very successful campaign, and I believe that community pharmacies contributed to this overall success for the campaign. Community pharmacy-based vaccination in Portugal has been a service that has been paid out of pocket by patients since 2007. So basically, people have to present at the pharmacy with a prescription. They have reimbursement for the acquisition of the vaccine itself, which may differ according to the individual. and according to the vaccine as well, and patients have to pay out of pocket for the vaccination service to the pharmacy. In 2023-2024, the National Healthcare Service contracted with community pharmacies in Portugal to dispense and administer flu and COVID-19 vaccines for free to the population. So both vaccine and the administration service were reimbursed by the National Healthcare Service for the eligible population that was identified by the General Healthcare Directorate. And these are people over 60 years of age and also people that are less than 60 years of age but have certain diseases that put them at risk for complications, either for flu and or for COVID-19. The main challenges that we have nowadays are vaccine hesitancy, but I also think that this is a wonderful opportunity for community pharmacies because we are able to be closer to the population, so decrease distances for people to vaccinate themselves, and we are also able to proactively address any hesitancy concerns and any doubts that people have on vaccinating. So actually I believe that the vaccine hesitancy has been one of the reasons why the government in Portugal has decided to include pharmacies in the COVID-19 and flu vaccination campaigns, because we are able to seize all opportunities of interaction with the population to make them aware of the importance of vaccination. We have shown in Portugal that we have decreased distances for people to be able to vaccinate themselves, and by having vaccinated over 70% of the population, we have shown that people have a preference for community pharmacies due to the trust that they place on community pharmacies, due to the proximity of the service, and also due to larger opening hours, which make the community pharmacies very accessible and convenient for people to vaccinate themselves. So I always like to address challenges as opportunities for community pharmacy, and this is what we have done in the last few years. We now want to also seize opportunities to increase vaccination uptake in adults, particularly those that are involved in the National Healthcare Plan vaccination plan, by also expanding the scope of pharmacist vaccination in vaccines like diphtheria and tetanus, which are vaccines that are nowadays only delivered in healthcare facilities because they are part of the National Healthcare Vaccination Plan, but where we think we could also assist in increasing vaccination coverage.